Hey everyone, it's Danielle VSG. Finally getting back on after a little hiatus because I had to finish some tests, and we all know I love watching. I mean, I don't mind watching pre-ops, but people that just kind of blab on, I don't know. Yeah, it's like that movie. Get to the good stuff. Thank you for my new subscribers. I've met some great people on here. Some of you are a little gun shy on making videos, and that's okay, since it is a public channel. And I try to put my settings on private, kind of like Facebook does, but I don't. I think it blocks even my subscribers from seeing it. I don't know. If anyone knows about that, feel free to message me a comment. So basically I had to get some blood tests, an x-ray, abdominal, ultrasound. They're looking at my... That's one of my dogs. As you all know, I raise dogs and work in an office. I got a new job. Love it. Best move I ever made, and I'm working part-time. Well, taking care of my dogs is full-time. Hi. Okay. Want to say hi? You just want to sit on the chair and go to bed? Alright. Those, you want to say hi to YouTube people? Okay, nobody wants to say hi to you. I'm sorry. But I did want to say thank you for the... Where was I? Do this a lot. I know you're laughing, Jody. But for the new people that are on here, having Heather, I think she was 3 weeks out. She had a really tough time. It was excruciating to watch her videos, but she never regretted it. Sleeved after 60, she's on Facebook too. I did delete a lot of people, and I'm going to give you a warning about Facebook. I had a lot of gentlemen requesting me and doing some pretty weird things, messages. Seen a lot of body parts, I can tell you that. That I didn't need to see. So I had to I'm just trying to stick with people that have some kind of title in their name. If not, message me and let me know that you're in the WLS community. So I had to delete some people. And there's the green tea people who are doing Beachbody. They're their own coach, so part of their job is to recruit other people, which is fine. It's just that I don't need it. If that's what I want to do, I'll do it. I know it's out there. I've seen it. But I don't need it on my Facebook page. Having said that, I'm still a little on the fence about, the closer that it gets to surgery, I'm on the fence about having the surgery. And I know I was speaking to Adrienne White. If you want to look her up, she's actually not going to get paid by insurance. She's going to have hers done in Mexico. And she's like, well, you're lucky. And hi. I don't have insurance approval yet, but it's a good chance that I probably will have an insurance approval and have to pay some out-of-pocket expenses. I think like $2 grand, I'm not sure, $1,500, but that's compared to the whole surgery, that's nothing. As much as I feel like I'm getting closer, the more my anxiety is like, don't do it, just don't do it. And as you know, if you're on my Facebook page, you know my husband's an asshole. He really is. It's just, ugh. Long story behind that, but it got to this point somewhere, and hopefully he gets happier. Part of me is like, do it, you'll be totally different in a year. I think, to sum it down so you guys understand, it's not that I don't feel fortunate, it's just that I feel like scared to go through surgery and the first few weeks after, and the closer it gets, the more I'm like, oh my god. So what happened in the meantime, why part of me still wants to get this done, and the reasons why. I had to see a psychologist. I had to have a barium test, which wasn't bad if you're doing it, if you're pre-op. I didn't mind the barium test. They had some kind of strawberry smell to it. She's like, do you want to smell it? It might help. They gave me this Alka-Seltzer thing to blow up my belly, my stomach, which was like a sour lemon. So I was like, nah. I'm like, what are you going to do to me? He's like, well, we're going to put you on this table, and then it's going to tip upside down. And I'm like, whoa, what? No, this is like amusement rides. That's all I could think of. It's like, no. And he's like, so he did it really quick. He probably could feel my weirdness and anxiety. Sorry, I don't know what's up with this pen. So anyways, yeah, so he was like, yeah, we'll get this done really quick. I'm going to coat your belly, and I kind of tell you to stand that way. I took the barium down like a trooper. I was like, might have been milk. He's like, you can drink it as fast as you can, but don't get sick. I'm like, well, I don't know. Are you prepared for that? It might go everywhere. I don't know what it's going to do, because I've never drank barium. And no, it was like a cup full, a good sized cup. And I was just like, I'm just gonna get it done. I stopped like midway and then went again, so he was able to get the pictures because sometimes they have to give you another one that's not as thick. And then he's like, well, your stomach's not coated, so you're gonna have to flip around. And I'm like, I'm like, he's doing this to be funny, right? So then the table, and he's like, no, hang on to the side of the table. Going backwards, and I'm like, yeah, no, I'm gonna fall off. He's like, you're not gonna fall off. I'm like, I'm falling off. You need to listen to me. He's like, you're not falling off, you're fine. So anyways, that came out good. All my tests came out good. I do have a fatty liver, which is, I'm over 40, if anyone's wondering. I did ask, why is that? If you drink alcohol or if it's not alcohol induced, it's because of your, high cholesterol. Can get fat deposits growing there, which isn't good because it can lead to damage in your liver, I guess. Small percentage is okay. I don't know what percentage, because I called an overworked, overwhelmed medical office, which is mine, my personal one, and she was like, I don't know, Danielle. So I'm sure they'll have more test results at the actual clinic, weight loss clinic in Lowell General. So the barium test went fine. The psychologist was like, wow, you're really dealing with some head hunger. I'd like you to do a 6-week program. I'm like, so she added stuff on, and basically the psychologist is there, from what she explained to me, to see why these behaviors are what they are from an emotional, psychological point of view. Goes into family history. What was that? What are you guys doing? Oh my god. What's going on over there? Anyways, so, do you guys want to say hi? Do you want to say hi to me? Hello? It's nice out today, so of course they're inside. When it was raining, they were outside barking in my last video, but it's nice out and sunny and wonderful, and they're in the office with me. Hey guys. So anyways, where was I? Oh, psychologist. So then she's like, well, there's risks, and if there's a leak, we have to keep you on liquids, and we don't know how long it's going to heal, and then the stomach can attach to the other side of the stomach, and it tries to heal that way, and then we got to go in with a balloon. So I'm like, I'm not having surgery. So it wasn't really helpful to talk to her, but I guess it was good to know the risks. Yeah. So she's recommending again some Hungry Head program, and what I have left is a cardiac test, a buddy class, and we have to do the surgery class. It's some informative class before you actually have surgery, and that's not till the end of September, which I can't get surgery until I've done 6 months of trying to lose weight on my own. How did I do on my own? I've lost about 4 or 5 pounds so far, and they want me to lose another 10. The psychologist, my nutritionist said it would be okay. My psychologist said, we'd like to see you try to lose that weight. So I got two different answers. So, yeah. Should be plenty of time to exercise now. I was hoping to do a home gym at home. That didn't work out because I changed jobs quickly and had some other expenses. But I think that's all I have to say. Again, thank you for new subscribers. I have Sleeved After 60, Having Heather. Sleeved After 60 is pre-op. One Step at a Time, VSG, don't know. Some of you don't have videos or information, so I don't know. Lacey Gomel, Sarah Craddock. Adrian White, I already told you, we had a nice conversation. She's having hers in December. She does have a date in Mexico. No More Lost Years joined me. Rona Hill. Amanda Cruz, Ellen Myers, Minnie Mel, Tennessee. She's already on here. Just had surgery. I think she's on week 6 RNY surgery. Sonia VSG is now SMC VSG. Hey Sonia, we tried to do a little comp, but it got lost in the shuffle somewhere because our lives are crazy. And then I think there's a Melly Martin VSG, but I'm still watching, obviously, my friends. I don't know, I became friends with some people, like Miss LV, hey. I'm still watching Anna.